Heart to Heart International was born from the spirit of volunteerism, beginning with a pioneering airlift to Moscow, Russia shortly after the Soviet Union fell. Now, more than 2 decades later, Heart to Heart International has grown to become an international humanitarian aid organization, engaging volunteers to impact health for the better around the globe. In times of disaster, Heart to Heart International responds,
They really need what you have brought.
rapidly mobilizing equipment, volunteers, and supplies. Heart to Heart serves as an important link in the healthcare chain, keeping it from breaking when the worst happens in communities across the U.S. Heart to Heart also provides a first line of health defense in the form of care kits and hygiene kits.
And we really need it. I really appreciate it. Me and my 2 daughters are here.
And Heart to Heart sends targeted shipments of aid to exponentially increase reach and impact.
Through Heart to Heart, we've been able to be out there and provide them with resources that no one had brought to them yet.
In times of calm, there are still those in need, and Heart to Heart International responds here too, helping to provide skilled volunteers to work in safety net clinics and in underserved communities, also delivering needed medicine and supplies to make it possible to render health care. Through the power of partnership, Heart to Heart expands access to health care around the world. From the Global Distribution Center, Heart to Heart outfits international medical teams with supplies and medicine, which in turn is used to treat thousands in the most needy communities. In Haiti, Heart to Heart International has established several clinic sites where Heart to Heart medical staff, along with volunteers, offer direct patient care for hundreds each week. Working with Haitians, corporate supporters, and donors, Heart to Heart has helped to establish medical laboratories, equips them, and offers continuing training for technicians. In the countryside, where no real healthcare system exists, Heart to Heart trains residents to become healthcare workers in their own communities. And Heart to Heart is addressing water and sanitation issues, getting in front of the cholera epidemic, bringing the message of disease prevention to isolated communities for the very first time. In clinics at home and overseas, in remote mountain villages, in hometowns ravaged by disaster, in community health centers, Heart to Heart International, with its cadre of volunteers, is expanding access to health care in all corners of the globe, making a difference for a world in need.